It's theoretically possible to assemble and interpret all of a patient's medical records for treatment and research, but in practice, it's nearly impossible. How can AI, interoperability, and a patient-centric approach change that reality? Masks are visible to everyone in October, but many of us have an invisible mask that we wear all year long, at work, in social interactions, basically everywhere. But therapy can help you rediscover your true self so you no longer feel the need to hide behind a mask of any kind. Masks are fun for Halloween, but we really shouldn't have to keep our emotions buried. That's where BetterHelp steps in. BetterHelp provides online therapy tailored to your life, convenient, flexible, and made to fit your individual needs. With just a few questions, you'll be matched with a licensed therapist who aligns with your preferences. And if you ever feel the need for a change, switching therapists is easy and comes at no extra cost. So whether you're managing stress, dealing with anxiety, or simply seeking personal growth, BetterHelp connects you with a professional who can guide you on your path to self-discovery and healing. Let BetterHelp help you take off that mask. Visit betterhelp.com/caretalk to get 10% off your first month. That's BetterHelp, HELP.com/caretalk. Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Bo Holland, founder and CEO of AllClear ID. Bo is launching Health Bank One to give consumers access to all their medical records. Welcome, Bo.
Thank you, David. Nice to be here.
The first question is, why is identity protection so important in U.S. healthcare?
Well, there's two dimensions of it. One is if someone steals your identity and then goes and gets medical care in your name, which does absolutely happen, now your medical records have been contaminated with somebody else's information, someone else's blood type, someone else's history. And as you know, that history is what determines the care that you're going to get, the medications that you can take. And so it's a real problem. And so that needs to be resolved and cleaned up. And there's a lot of medical identity theft. There's also just plain misidentification, which is not malicious. But, John Smith goes to the hospital. They get matched to the wrong John Smith. And now the records are, bent that way. And so being able to have a strong identity that solves those kinds of problems, both preventing the bad guy from using your information or the good guys from simply making a mistake like a record mismatch or a duplication is really key. So that's one side of it. The other side of it is we see this incredible rise in these ransomware attacks in healthcare. And these are destructive and they really have impact on patients. During the Change Healthcare breach earlier this year, people couldn't get their prescriptions refilled because the data wasn't available, right? Ascension, had a massive outage. We live in Austin, Texas, and, for weeks, the hospital system there was working off of paper, and they didn't have access to the data. And so that, makes you think, like, hey, maybe I should have a copy of this myself. And so if those big systems go down, at least I've got the data with me as a backup. And if I need to go to the pharmacy and get something refilled, I can at least show them the record. I can send it to them. If I need to get care, my records are always available. So, as a resiliency system, as a backup system, when these attacks happen, you should have your own copy of the data.
What is Health Bank One and why would anyone need it?
So it is a bank that works for patients, and it enables patients to basically exercise their new rights to have all of their data and actually control, their medical information. So today that's not true, right? Our data lives all over the place, at every doctor you've been to, every pharmacy, every lab, and you don't really have access to it. And so that is a real problem. The next place you need to go to get care. They always want to know your history. You fill out those forms again and again and again, and they never seem to remember anything about you. And so what the bank does is it's a new entity that works for the patient, and it does a couple of simple jobs. Collect all of your data in one safe place and keep it very secure with banking grade technology, not healthcare grade technology. And then number two, enable you to share that data with anyone worldwide. And so as a patient, we are free agents and we can share information freely, just like with our money, right? We can spend our money anywhere we want to. We can spend it wisely, poorly. We encourage you to do your best, but now you have that same power over your data. So it gives you a lot of options about where you're going to go and get care. And then the third thing it does is actually helps you understand those records, understand your care, understand your conditions, what questions you should be asking the doctor. We built in an AI capability that will read in on your medical records and can answer any medical question for you. We're using GPT-4 there, which is the gold standard. And so it's a really empowering experience to get that lab test. And instead of looking at it and going, is that good, bad, indifferent? I don't know. Is it worse than last time? I don't know. Being able to just ask a question in plain English, how am I doing? How is this better or worse than last time? What should I do? Same kind of questions you asked your doctor, but you only get 17 minutes with your doctor, once in a while. Now you've got an app. The bank provides you that capability. And importantly, privacy, everything is private. No data leaves the bank without your explicit consent. So you can have these chat conversations. You can take advantage of AI. You can have your records, in a safe and very private place.
You mentioned AI is a key part of Health Bank One. How will that evolve if you look ahead maybe 3 years? What would be different?
Whew, that's a great question. And, hard to even imagine where this is going. You look at the last 24 months, how it has just, gone by leaps and bounds. And, this technology is remarkable. And one of the things people don't realize is that medicine has been publishing information forever. And so in terms of what ChatGPT understands and knows, it is very deep in medicine and very knowledgeable. And Stanford has index where they show it's beating, most medical students, in terms of knowledge. It's better than most doctors in terms of knowledge and accuracy. And the bet is over the next, 2-3 months, we're going to get another upgrade here that will put it in the 99% accuracy level. So whether that's, pans out exactly or not, the point is that it's good today. It's really good, and it's going to get a lot better. And so I think the standard of care is actually going to flip. There's been skepticism of AI, totally get it. But if you use it responsibly with the right training and boundaries. I think now if you're not using AI, if you're a doctor and you're not using AI as a way to make sure you're up to date on the latest, that you're considering every alternative when you see something new you haven't seen before, maybe the AI has. And so if you're not using that kind of a tool as a doctor, if you're not using that kind of tool as a patient, if you're still just Googling and WebMDing, you are way behind the curve. So I think this is going to be a tool that goes from, nobody even heard of it, 24 months ago to now it's an absolute essential tool that you've got to have. And it really does make a difference, particularly on the communication front between you and your doctors. So you can have, meaningful conversations where you actually understand what they're talking about. And I think most of them will enjoy talking to someone who's, more informed than what we are today.
Well, that's it for the latest HealthBiz Brief. If you like what you hear, check out my HealthBiz podcast for a full-length interview with Bo about his life and career. Bo Holland, founder and CEO of AllClear ID, thanks for joining me today on HealthBiz Briefs.
Thank you so much, David. Enjoyed it.